Well, we go from Italy to New York now, where workers in the private sector must now be vaccinated. The rules were imposed in an attempt to prevent another wave of infections during the winter. Here's the mayor, Bill de Blasio.
It is time. Look, this is how we put health and safety first, by ensuring that there is a vaccine mandate that reaches everyone universally in the private sector. A lot of folks in the private sector have said to me they believe in vaccination, but they're not quite sure how they can do it themselves. Well, we're going to do it.
The new rules will affect 184,000 businesses and will take effect from December the 27th. Let's speak to Danielle Ompad, Professor of Epidemiology at New York University. Thank you very much for joining us on the BBC. Do you agree with the Mayor's approach?
I'm really excited that we are going to be doing some vaccine mandates. We actually have very high vaccination rates in the city. It's around 80% of adults are fully vaccinated. So there's about 20% of people who are not. And this is going to be the way that we can get everybody vaccinated. And it's a big concern because of the variants that continue to emerge.
How do you think this will be enforced?
So what I do know for the public sector workers is that if they're not getting vaccinated, then they have to do weekly testing, and that the onus has been on the agencies to ensure that that is happening. So I suspect something like that will happen for the private sector as well. However, there is not as much time to get those policies into place by December 27th, but New York businesses are pretty savvy about making things happen.
Are you concerned this might lead to a minority of staff saying no thanks and walking out and creating staff shortages?
I think that's possible, but with the public sector mandates, there was an option for weekly testing. So if you're not vaccinated, you had to get tested on a regular basis. So I think that there will probably be some ways that that can be dealt with, particularly for those people who are not able to get vaccinated because it's contraindicated for health reasons.
Is there any part of you that is uncomfortable with the idea of mandating a vaccine?
I understand people's hesitancy around vaccine mandates, and generally giving people the option to have a treatment or not is really important. But right now we're coming into 2 years of this epidemic or pandemic. We've had over 800,000 deaths in the United States, and we're still seeing variants emerge. And so I'm really concerned about the people who may not survive the pandemic. And this is an opportunity for us to really take care of our community.
I wonder if you step back here and look at the bigger picture, not just across the US, but across other developed countries as well, particularly in Western Europe, where this is actually an admission that the current vaccine strategy just didn't work. The idea that you could voluntarily offer it and see who takes it up just hasn't been enough to contain COVID-19.
I think that there was an issue with people understanding herd immunity and kind of relying, well, if I don't get vaccinated but everybody else does, then we'll reach herd immunity and we'll be okay. But herd immunity actually requires quite a substantial proportion of the population to be vaccinated. So I think we can no longer rely on our neighbor to get vaccinated for us to reach herd immunity. And I think we've gotten just about everybody who wanted to get the vaccine, and now it's really time to encourage all those people who have been hesitant to really reconsider getting vaccinated so we can end this pandemic.
Professor Ompad, thanks for joining us. We appreciate it.
Thank you.